Statistics from the National AIDS Control Program indicates that from January to June last year, Ghana recorded 23,495 new HIV cases with a total of 4,655 infants who were screened through the DNA PCR. Only 99 tested positive. According to the Ghana AIDS Commission, while high-risk behaviors had been increasingly pervasive in the Ghanaian society, prevention protocols were least respected by individual Ghanaians. The Commission noted that these behaviors have sustained high number of new infections, averaging 21,000 annually over the last 5 years. It is in this light that the government intends to introduce the HIV/AIDS self-test kit to curb the spread. Citi News team sampled the views of a section of the public regarding the kit. Ibrahim Seidu, a fabricator, expressed mistrust about the kit and says he will prefer to go to the hospital than to purchase the kit.
The best thing is like you have to go to the hospital, then maybe test it from there, because sometimes the testers, the HIV test this time, we bought it at the pharmacy. Sometimes some of them fails. So to me, the best thing is to go to the hospital and do the test over there.
You know, the government should do like this, education should go on about how and what and how to go about it. I think it will help, because a lot of people might be going on with this thing. They themselves, they don't know. And there will be some people that don't have it. So it's like people are at risk. But if they introduce this thing and then everybody can go and have this test done, I think it will stabilize everything and the rates and everything will come down.
When it's been introduced to the pharmacies, most of the community pharmacies have personal relationships with their customers, and with that they'll be okay and feel free to talk with you so that you also do what? Help them by testing with a kit. So I think that will really help.
Speaking to Citi News, the Director General of the Ghana AIDS Commission, Dr. Tremi Atuahene, allayed fears and myths about the kit and assured the public that the kit is 99.9% effective.
The test kit is the same that is being used in health facilities. They are not different. And therefore, the accuracy of the test kit is not in doubt. It is 99.999% accurate, if that is what you want to hear. So what I'm saying is that it is accurate. You look at the specificity and sensitivity, and those things I am not in the office now. I'm actually somewhere in a village, and so I don't have the specific. I could give you the specific test kit and the level of sensitivity and specificity for you to know how it works and how accurate it is. So this is what I would say. I want to assure the Ghanaian public that the self-test kits are accurate, and if you test, if you use it, you will have all the information to guide you to. There is an information sheet in the pack which will guide you to do the test properly, be able to read the results and interpret the results. That information is in the pack.
Meanwhile, the program's manager of the National AIDS and STI Control Program of the Ghana Health Service, Dr. Stephen Ayisi Ado, firmed up assurance about the test kit.
Certainly people are shy or they are afraid of the outcome of something, and now we've made a lot of progress. HIV is no more a death sentence, we say. If you get to know quickly, you can then come for treatment. So we should make it easy for you yourself to know without anyone being around, and then we can get, you can be linked to treatment. So all these is supposed to make it possible for us to achieve our universal health coverage objectives and to end the epidemic.
He demonstrated one of the methods to use the test kit.
This is the oral quick type. You don't touch here, you only touch here. It has two inscriptions there, C and T. C is control, T is the test. Okay. So what you do is that you swab on your gown. So you are not licking, it's not saliva. Okay. So you swab. Then you turn the other side, swab lower, very close, opposed to your gum. Then you open and then drop it in here. Then you start timing. So if it's your phone, you start looking at the time. When did you drop it? And then you wait for some 10 minutes.